Okay, guys, I'm going to quickly do this one for B. We're discussing polypharmacy when it comes to elderly folks and how it interacts with their getting around, functioning, things of that nature. So, shall we get going on B? why why this matters for older adults. Older adults are more likely than younger people to live with multiple chronic conditions such as hypertension, diabetes, arthritis, or heart disease that each require ongoing treatment. This often leads to polypharmacy, the use of 5 or more medications at once. While each drug may be prescribed with good intentions, the cumulative effect can be dangerous. The risks aren't just theoretical. Polypharmacy is consistently linked to higher rates of hospitalization, disability, or even mortality among seniors. What what very risky means in practice? Drug interactions. Medications can interact in unpredictable ways. For example, blood thinners combined with certain pain relievers can cause internal bleeding, while antidepressants mixed with other drugs may dangerously alter heart rhythms. Side effects compounded. A single side effect may be manageable, but when dizziness, blurred vision, and constipation and fatigue occur together, they can quickly erode independence and safety. Delirium and cognitive decline. Drugs that affect the central nervous system, like sedatives, anticoagulants, and opioids, can trigger confusion, memory lapses, and or worsen dementia symptoms. Falls and fractures. Medications that lower blood pressure or impair balance increase fall risks, and falls are the leading cause of injury related deaths in older adults. Hospitalizations. Adverse drug events are one of the most common reasons older adults end up in emergency rooms, often due to bleeding, kidney injury, or dangerously low blood sugar. Reduced adherence. Complex regimens make it easy to miss doses, accidentally double up, or confuse one pill for another. Undetermining treatment effectiveness. Why older bodies are more vulnerable. Slower metabolism. The liver and kidneys, which filter and clear Drugs work less efficiently with age. This means medications linger longer in the body, raising toxicity risk. Higher sensitivity. The aging brain and cardiovascular system are more interactive to more reactive to certain drugs, making older adults more prone to sedation, confusion, or blood pressure drops. Multiple conditions. Treating one illness may inadvertently worsen another. For instance, steroids prescribed for arthritis can exacerbate diabetes or osteoporosis. Common red flags to watch for. Anticoagulant load. Medications for allergies, bladder problems, or sleep often have anticoagulant effects, which can cause confusion, constipation, and falls. Sedatives and sleep aids. Benzodiazepines and Z drugs may impair memory and coordination, increasing fall risks. Opioids and gabapentinoids together. This combination can dangerously suppress breathing and heighten sedation. Duplicate therapies. Sometimes two doctors prescribe similar drugs without realizing it, leading to unnecessary duplication, unnecessary long-term use. Medications intended for short-term use, like proton pump inhibitors or steroids, are often continued indefinitely without reassessment. Safer management strategies. Medication review. Periodically review all prescriptions, over-the-counter drugs, and supplements with pharmacist and clinician to identify risks. Deprescribe approach. Gradually taper or discontinue medications that no longer provide clear benefits, focusing on quality of life. Start low, go slow. Begin with the lowest effective dose and adjust cautiously. One change at a time. Introduce or remove medication sequentially to monitor effects clearly. Simplify regimens. Align dosing schedules. Reduce unnecessary as needed medications. And avoid overly complex routines. Non-drug options first. Lifestyle interventions like exercise, diet, sleep hygiene, or physical therapy can often reduce the need for medications, practical uh, practical prompts to use with clinicians. Goals. Which medications still align with my current health goals and quality of life? Risk benefit. What are the main risks of each medication or medicine for someone my age? And are there safer alternatives? Interactions. Are any of these interacting, including vitamins or OTCs? Stopping plan. Which meds could we try trail off safely, and how would we monitor? Monitoring. What signs should we watch for if we adjust doses or discontinue? The bigger picture. Polypharmacy isn't just a medical issue, it's a social and systematic one. Older adults even older adults often see multiple specialists who may not coordinate care, and cultural or economic factors can influence whether patients feel empowered to question prescriptions. Community-based education, caregiver toolkit, and culturally responsive deprescribing checklists. Can help bridge these gaps by reframing medication management as a collaborative process between patients, families, clinicians. We can reduce the risk while honoring autonomy and quality of life. Would you like me to sketch out a community friendly deprescribing checklist that caregivers or outreach workers could use to spark safer medication conversations? Okay, guys, I'm going to sit here for a couple minutes. I'm going to do like an after show comment section for y'all. See what everybody thinks about polypharmacy and elderly. I'm going to see whether I should do another show or not for y'all. So I would encourage everybody to give me some show feedback about this subject, how it influences them, their families, whether they're taking care of an elderly person with this issue or not. So those are some topics I will throw out there.